Welcome! In this explainer, we are going to break down how young adults with disabilities can level up to a whole new world of benefits when they hit that big 1-8. Let's take what feels like a really confusing process and turn it into a clear, step-by-step guide.
Okay, so let's just dive right into the big question. For so many families, this moment can feel like you're walking right up to the edge of a cliff. All the support systems you've relied on are about to change. But what if we looked at it differently? What if this isn't an ending, but the start of a whole new level of independence and opportunity?
First things first, we have to understand the single biggest, most important change that happens on their 18th birthday. Seriously, this one shift is the key that unlocks everything else we're going to talk about.
And here it is. This is the big switch. Before they turn 18, eligibility for most things is tied to the parents' finances. But the second they turn 18, boom, the system sees them as their own person. It no longer looks at parental income. And that is a huge deal because it means they can now qualify for all kinds of support based on their own financial situation, which is often pretty limited.
So with that massive change in mind, let's build out the first pillar of support. This is all about creating a solid financial foundation, that bedrock for their independence.
So what exactly is SSI? To put it simply, it's the most important financial benefit to apply for right out of the gate. It's a reliable monthly cash payment that comes directly from the Social Security Administration. It provides a predictable income, and that's really the cornerstone of financial security.
Now this number right here, this is the crucial part, $2,000. To be eligible for SSI, their own countable assets have to be below this limit. And because the system now sees them as an individual, that threshold suddenly becomes a whole lot more achievable for many people.
So, how do you actually apply? It might sound like a huge headache, but I've got some good news. You just start with an application to the SSA. And for the proof of disability, well, you probably already have the exact documents they need. Things like the prior written notice and those 3-year reevaluation reports, they should be sitting right in their school files.
All right, so with that financial piece starting to click into place, let's look at how it connects, almost like magic, to our second pillar, health insurance.
Now, what's really cool is how these first two pillars are linked together. In a lot of states, like Connecticut, for example, once you get approved for SSI, you are typically automatically eligible for Medicaid, which they call HUSKY. The SSI application basically does double duty as your health insurance application. It's a fantastic 2-for-1 deal.
And believe it or not, it gets even better down the road. This right here is a potential game changer. There's a program called MedConnect that allows them to get a job, start making a real salary, we're talking up to $75,000 a year, and still keep their Medicaid coverage. This just tears down a huge barrier, making sure they never ever have to choose between a career and their health.
All right, Pillar 1, financial stability. Check. Pillar 2, health coverage. Check. Now for Pillar number 3. This is where we start looking forward and really building their future, whether that means college or a career. This is the real level up.
The key player here is the Bureau of Rehabilitation Services, or BRS. This is a state agency, and they run a specific program for high school students called Level Up. And its whole mission is to give them the tools and support to bridge that gap between high school and whatever comes next. And this isn't some one-size-fits-all cookie-cutter program. Just look at how personalized this support can be. For someone like Zaya, who wants to be a graphic designer, BRS can offer college counseling. But for someone like Jida, who's still figuring things out, they provide job exploration counseling to help her find that passion.
And the support goes even deeper. The Level Up program can set up work-based learning, things like paid internships or on-the-job training. And maybe most importantly, it provides self-advocacy training, teaching them how to confidently ask for the accommodations they need to crush it in college and in the workplace.
So how do you get this all started? It's often way easier than you'd think. Just like the quote says, your next step is to make a direct formal request. At the very next school meeting, just ask their case manager to make a referral to the school's BRS liaison. That simple action is what gets the ball rolling.
Wow, we have covered a ton of ground, haven't we? From money to healthcare to careers. So let's pull everything we just talked about together into one clear, simple, and totally doable action plan.
Here you go. This is your roadmap. You've got the 3 pillars right here, side by side. For SSI, that's the money, you apply directly to Social Security. For HUSKY, the health insurance, that pretty much follows right after SSI is approved. And for BRS, the career and college support, you kick that off with a simple referral request to the case manager.
3 pillars, 3 clear first steps.
You see, following these steps isn't just about getting through some bureaucratic process. It's about intentionally building a foundation for their future, one pillar at a time. You're giving them the tools to build their own independence. So, looking at this plan, which step will you take first?